Michigan Public Health Institute Center for Healthy Communities, and I'm here with...
Hi, everyone. I'm Julie Moore, a Center for Health Equity Practice here at MPHI.
Thanks for joining us today. We are going to be talking about our project Achieving Birth Equity Through Systems Transformation and the training and technical consultation opportunity that we have for the project. So a couple of weeks ago, we sent out a call for community partners, and the purpose of the webinar today is to give more information about the project and about the opportunity, and to give people a chance to ask us questions. So we will have time, dedicated time at the end to answer any questions that you have, but you can also feel free to type in questions into the chat box along the way, and we can answer those at the end of the brief presentation that we have. All right, so I'll go ahead and get started. The reason we're here today, and the reason that we have this project right now is that the Black and Native American maternal and infant mortality rates are 2 to 4 times higher than the rates for white women and babies. And then there's a growing body of evidence that points to racism as the root cause. So this project, it's called the ABEST project, which stands for Achieving Birth Equity Through Systems Transformation. The goal of this project is to disrupt racial inequities in maternal and infant mortality, and to really do that by focusing on 2 things. So we have an explicit focus on addressing root causes of inequities, such as racism and sexism, and a focus on systems change. Because if we want to truly address those root causes, which exist at the level of systems and structures, then we really need the work to be happening at the level of systems. And the goal of this project is that by the end of the project period, which is October of 2020, that we'll develop specific actionable strategies to challenge the status quo in government and communities. So diving in a little bit deeper to those sort of 2 core aspects of the project. So as I mentioned, we have an explicit focus on root causes. So some of you may be familiar with this framework from the Bay Area Regional Health Inequities Initiative. It might be new for some of you. If it is something that you haven't seen before, I'll just draw your attention to the continuum that's at the top here that says downstream and upstream. And so this really explains sort of what we're talking about when we're saying that we really want to focus on root causes and moving the work upstream. So there's a lot of work, good work that's happening downstream and even midstream right now in terms of clinical interventions or public health programs that are happening at the individual level and really addressing clinical care or risk behaviors, or even looking at social determinant of health screeners. But that really, if we want to truly address root causes, then we need to not only be focusing there, but we also need to be focusing our work upstream on these other areas like living conditions and institutions and social inequities. So ABEST really complements the work that's happening downstream by adding this work of looking at root causes, and so looking at things like racism and sexism and where they're showing up in structures and systems, so places like policies or institutions like schools, or in different cultural representations and different norms that we have around race. So if we hope to address root causes, then we really need to be working on systems change, right? And so this is a model of systems change that we found really helpful for this project. It comes from FSG, so you may be familiar with some of their work that they've done around collective impact, but really they've identified these 6 conditions of systems change. And the idea here is that in order to be doing really transformative systems change that is really changing the way that systems are functioning, we need to be looking at all of these things. So it needs to go deeper than, just looking at policies and practices and resources within systems, And we need to be looking at things like relationships and power within systems as well as mental models, right? And so the mental models are like the ways of thinking that are holding the problem in place. So a great example from the area of maternal and infant health is that we often focus on individual behavior, particularly that of mothers, rather than looking at the way that systems are putting infants and mothers at risk. And so if you are really addressing all of these things and having that focus on those aspects like relationships, power, and the way that we talk about the issue, then you're doing work that can transform systems. So then in terms of the project then and how all of this sort of shows up, so we're calling this sort of like phase 1 of the project, and so, I'm just getting a notification about the polling. And so we know that this type of systems change is definitely not easy to do, and it feels challenging, especially, for systems leaders who haven't really had a lot of training on how you do this type of systems change. And so that really is the focus of the ABEST project is, working with leaders to build this understanding of root causes and build an understanding of systems and how to lead systems change, and then working with those leaders to develop specific actionable strategies for systems change. So really doing that work of thinking through it, exploring it, and thinking about what is the best way to do this work in our community. And so in order to do this project, we need 2 community partners, which is the purpose for the call for community partners that went out a couple of weeks ago. Ideally, we would like to have a community partner that focuses on a Black community and a community partner that focuses on a Native American community, since those are the 2 communities that have the largest inequities when it comes to maternal and infant mortality, and that's why that's the focus that you saw for the project in the call. So phase 1 then will end in October 2020, and then phase 2 is really carrying the work on. So that's the implementation of the what we're calling roadmaps for systems change of those strategies. And so this work, the ABEST project itself, is funded by the Michigan Health Endowment Fund, and the Health Fund has said that they're interested in funding the implementation of the roadmaps, although of course they can't promise that they will. But that another part of the ABEST project is working with our community partners in order to find funding in order to do that next phase of implementation. And then just pulling us all back to remembering that the ultimate goal here is reducing and eliminating racial inequity in infant mortality and maternal mortality, and ensuring that all Michigan families are experiencing healthy birth outcomes. So now that I've told you a little bit more about the project, and I'll tell you a little bit more about who the project team is and the different partners and things that we have. And then I'm going to turn it over to Julie to talk more about the work that we'll be doing with our community partners. So the project team is here at MPHI. So we have the Center for Healthy Communities, which is my center, and the Center for Health Equity Practice, which is Julie's center. We also have the Center for National Prevention Initiatives, which does like the child death review and like FEMA reviews and supports that work. And then in terms of state partners, so the Maternal Infant Strategy Group is a group of maternal child health leaders from across the state of Michigan, and they've been serving as an advisory group for MDHHS's Mother-Infant Health and Equity Improvement Plan. And they sort of have a dual role in this project. So they do serve in an advisory capacity for the project, but they also are participating in the capacity building. So the work that we're doing around building knowledge of health equity and root causes and systems change, that also is being done with the Maternal Infant Strategy Group, so that as MCH leaders across the state, they're also building that capacity to do this work. And then the ABEST project does align with the MDHHS's new improvement plan. The plan has a call to action for all of us for health equity to address structural and systemic inequities, and that is exactly what the ABEST project is focused on doing. And then we have a few different consultants that are working with us as well. Bayard Love in Health Resources in Action will be leading some of the workshops that we're offering through the project that Julie will tell you more about in just a second. And then another one of our consultants is Vijaya Hogan. And so Vijaya has conducted research on understanding and addressing health inequities in perinatal outcomes. She's held positions as an epidemiologist at the CDC, as a clinical professor at UNC Chapel Hill, and also as a program officer at the W.K. Kellogg Foundation. And she now focuses on using all of that expertise to help build capacity of maternal child health organizations and implementing strategies to effectively address social determinants of health and eliminate health inequities. And so we are very lucky to have her as a consultant and thought partner with us on this project. And with that, I will let Julie talk.
Great, thanks, Jen.
Yep.
All right, I'm going to talk a little bit about what community partners can expect. So a little bit about what we will provide and a little bit about what we will ask of our partners. All right. So there are four major components that we're thinking about for the ABEST project. Beginning in the fall of 2019, so this coming fall, we'll have some support in reviewing data to assess your community's birth equity status and some main factors contributing to racial inequities. Starting in that late fall into spring of 2020, our community partners will engage in a series of 3 workshops to build knowledge and capacity to engage in the systems change work. This will, after we build all that knowledge and capacity, you'll enter a 6-month consulting phase where it'll be time to apply the new knowledge into specific actionable strategies for your community. In order to support all the work, of course, the ABEST project is supporting all of these workshops and activities, but we can also offer up to $5,000 to each of our partner communities to do for additional support, and we'll talk a little bit about how that might be used. We really want to emphasize that we're coming to you. So as our community partner, we're really hoping to minimize the impact of additional travel and inconvenience. So all workshops and in-person meetings will be held locally for each community. All right, now let's spend a moment looking at some of these components in greater detail. So the first thing that the communities will engage with us in is, after communities are identified, is to take some time to dive into existing data. So the ABEST team is currently working on a literature review of existing studies and an environmental scan of current programs and initiatives that are addressing racial disparities in birth outcomes. So the results of both of these will be shared with our community teams for deeper discussion about how the findings might relate to what is happening in their communities. We'll then work with each of the community teams to review their own community data with a health equity lens. So moving beyond documenting the disparities and beginning to ask why. So that question of why the disparities exist might lead us first to the social determinants of health, such as access to transportation or access to affordable care. But if we keep asking why some people don't have access to these things, this starts to lead us to think about root causes. So power imbalances and structural features of our communities that hold these disparities in place. So when we get to that level, we might realize pretty quickly that we'll need to start looking at data outside of infant and maternal mortality data, maybe data like neighborhood racial segregation or economic opportunities or high-quality education. So we'll work with those community teams to look at data from multiple sources. Finally, it's really important to look outside some of the conventional data sources to fully contextualize them. So we'll be encouraging community teams to take time to listen to your communities and think about how we can build in some of those rich lived experiences of families who have been impacted by infant and maternal loss to help us understand the real story behind what's happening. Okay, so after communities have had an opportunity to kind of take stock of what's happening in their community, we'll start the workshop series. The first of the 3 workshops is a 2-day health equity workshop facilitated by MPHI Center for Health Equity Practice. And the goals here are to establish a shared vocabulary for discussing and conceptualizing health equity among your team. So the teams will examine how social identity interfaces with public health outcomes and practice. We'll discuss root causes and the levels of oppression. We'll consider power as it relates to oppression and change. And we'll apply a health equity framework to maternal and infant mortality issues. This second workshop on the groundwater workshop by consultant Bayard Love will be a bridge from our conceptual work on health equity to our thinking about systems and structures that hold inequities in place. So through this half-day workshop, the communities will learn a useful framework for understanding racism as fundamentally structure in nature. We'll gain tools for using stories and data to present this framework, and an opportunity to expand the conversation beyond specific individual factors and make you realize that this is an interconnected systems approach is necessary to address infant and maternal mortality. All right, and finally, we'll have a systems change framework. So this will be led by Consultants Health Resources in Action. And during this framework, we'll really be getting down to applying all of this to how we can impact systems. And so they will be working with the communities to apply a health equity in all policies lens upon maternal and infant mortality issues. They'll describe that lens as what the key elements of it are, and they'll overview some national case studies. They'll ask communities to conduct social network analysis of teams to identify key sectors and stakeholders, and which of those sectors, and stakeholders are needed in your coalition, and to conduct a systems power analysis to identify the various policy levers, power dynamics, opportunities, and challenges to address maternal and infant mortality in the community context. Finally, there'll be an opportunity to identify windows of opportunity for improved community engagement, data collection or issue prioritization, and to intentionally promote health and racial equity in your community. Okay, all of that capacity building is ultimately leading to an opportunity to engage in planning to address racial disparities and healthy birth outcomes. So MPHI Center for Healthy Communities will be joining the teams with expert facilitation to develop these roadmaps. The goal of the roadmaps is to build a shared vision for birth equity in your community, identify elements that are keeping the community from achieving your vision, determine a strategic course of action to overcome barriers and catalyze movement toward your vision, to determine agreed upon specific and concrete actions and the responsibility for major accomplishments, and finally to design some implementation strategies. We understand that system change is hard to measure and is a long-term game, so we will really emphasize a focus on some process indicators that speak to systems change work, such as strengthening collaborations with leaders who have influence over key systems. And it's important for us to think about measures of incremental change towards that greater goal of reducing and eliminating disparities and healthy birth outcomes, while of course for ongoing monitoring of those ultimate goals. All right, and finally, we do have that offer of financial support for our 2 partner communities. Well, we have a great deal of flexibility about how that is implemented and used. We have some suggestions or some ideas for how it might be used. For example, you could use it to reimburse some staff time for internal project coordination, travel to the workshops and meetings, reimbursement to community partners, or you might often decide as you're on the journey with us that you might need additional meetings to do the work in between the workshops and during strategic planning phase. How to access that money. Each of our communities will establish a contract with MPHI. $5,000 will be delivered in 2 payments, one after the 3 workshops are complete and one after the end of the in-person consultation is complete. But we also can be somewhat flexible to meet your needs. So if there is an organization or a lead organization needs to make different financial arrangements with us, we would be happy to talk with you about that. Now I get to hand it back to Jen.
Yeah, you do. All right, so I'll talk a little bit about the selection process. So there are 4 phases to the selection process. Today is the phase 1, learning more about the project during this webinar. And then if you're interested in being one of our community partners, then we'll have you submit a letter of interest by July 31st. During the month of August, we'll do interviews with communities that are interested, and then we'll be selecting our 2 community partners by September 30th. So in terms of that letter of interest, this is not like a big, huge, formal, like concept paper kind of letter of intent type of thing. It really is just a chance for you to sort of formally say we are interested in being one of the community partners so that we can schedule an interview with you. A couple of things that would be helpful to have in there, so the sort of 2 things we're asking for is just to let us know who the membership is of the team that is applying. So who are the existing partners? Are there, maybe there are partners that aren't currently engaged, but that, you would hope to engage as part of the process. And then also let us know how the partners represent the target community. And then the other thing is just a statement of your readiness to engage in this work. So your readiness to, start working on root causes and doing systems level work. And then in order to meet the goals of the ABEST project, because we do have specific goals, because we are funded to do this, there are sort of these essential criteria that we'll use to select our community partners. So the first one is that readiness, that you're really ready to address the root causes of birth inequities, and that you have the understanding of the need for systems level change, this is the work that you're ready to do. And then a focus on addressing inequities for Black or Native American populations, as I mentioned earlier. Potential for buy-in and active involvement of both community and systems leaders, because really the systems level work is going to be most impactful if we have the people who have the levers to move those systems involved in the work. A prior experience with or a willingness to engage in cross-sector collaboration. And with this project, we're really thinking sort of outside the box and would love to see some, sort of non-traditional partners. So some of the different sectors that, may be involved would be obviously public health, human services, payers, mental health, hospitals, law enforcement, housing, transportation, philanthropy, businesses, faith-based, nonprofits, education, early childhood. Like, obviously you don't have to have all of these people engaged, but these are some ideas of some of the partners that you may have. The leadership team should have members that authentically represent the community that's being served, and then the community should have a commitment to implement and sustain the efforts long term. So that is the sort of full overview of ABEST project and our call for community partners and the opportunity. So at this point, we can answer any questions that people have. We have our friend in the room who has been monitoring the chat box. Is there anybody that posted questions, Danielle?
No.
Okay. Can we unmute people?
Yeah. So.
Do I need to do that?
Yeah, if you click participant.
I think I'm doing it. We'll see. I'm unmuting people individually.
Oh, you can just unmute them all. You are.
Okay, so I am unmuting people, so if anybody has a question, just go ahead and ask your question, and we will do our answer. Oh, here's a question. But then it disappeared.
Are the workshops already scheduled? Will they primarily be held in Lansing?
Yeah. Thanks, Lisa. That's a good question. So no, the workshops are not scheduled. We have sort of a general schedule that we're thinking of that would work for them to occur, but that we will be scheduling those with the community partners. So we'll work with you to figure out a schedule that works, and they will not be held in Lansing unless that's where you want them. So we are planning to come to you, yeah.
Mm-hmm.
Thank you for that question. Okay, so Safa has a question.
Would you be open to a later date
Yeah.
for submitting a letter of interest? Noting that the due date is approaching soon and a lot of our partners here have upcoming summer off.
Yeah. I think we can probably be flexible on that date for sure. I think we just want to make sure that we have our community partners in place and ready to go so we can kind of get started by this fall. We'd like to have the kickoff be in October. So yeah, I think, maybe on the fly, how flexible can we be?
One approach could be also if you could reach out to us and let us know that you're intending and you're working on a letter and you're just holding out to engage a few more partners, just so we have a sense of who's coming in, and then maybe we can start sort of our review process of the letters we have, but know that we'll keep an open mind when yours comes in. That would be super helpful.
Yeah, that's such a good idea, Julie. Thank you.
Thank you. I'm glad that worked.
That can be on a case-by-case basis. Yeah, so if you feel like you are interested, but the July 31st date isn't working for you, just let us know. You're welcome.
Yeah, and as Jen also mentioned with that letter of interest, we understand that that the team is going to maybe a mix between established team members and those hoped-for team members. And so if you feel like you sort of have a critical mass of enough of core members of your team, but you express in that letter that there are additional stakeholders you'll be reaching out to, that is, we're expecting a certain level of that as well.
Yep. Other questions? Okay. All right, well, I'm not seeing any other questions come in. Oh, let me close this. Hello. Oh, there it is. Well, so I'll just, I guess, end by saying that we are really, really excited about this project, and we're super excited to, hear from people who are interested in working on it with us, and to really embark on this journey together with our community partners. So we hope to hear from you. We hope some of you are interested in participating, and we can talk more about it with you during the month of August. If you do have any other questions about the project or about the opportunity at all, please do not hesitate to reach out. My contact information is right here on the screen, so feel free to email me or give me a call at any point. I'm happy to talk about it with you. Okay. All right. Well, thank you so much, everybody, for joining. Have a good day.